Next, we're going to be looking at the anterior thoracic and arm muscles. Now, the first group you see here are the pectoral muscles. You don't have to memorize the different names, but we have the xiphihumeralis and then the pectoralis minor and major. Strangely enough, the minor is actually larger than the major in a cat. Now, these are all going to be fused together. Now, I've actually pre-dissected these so you can see the separate muscle groups. Don't expect that they're going to come apart so easily. On so many of the cats, these are going to fuse into a huge muscle group. That's going to be very difficult to isolate. So you'll want to lift this away from the sternum and the underlying abdominal muscles like so. What we're eventually going to do is just cut the entire group off to get to the bony thorax so we can get into the heart and lungs. Next, up the shoulder, I've already removed this muscle here, the clavobrachialis, which I mentioned on the last video. This was covering up the deltoid and the brachialis. And what it was also covering was the insertion of these pectoral muscles. So all of these pectoral muscles, many of them insert right here on the top of the humerus. And actually, if we peel this muscle group back, you might actually be able to hear as I strike the humerus. That's it. All right, so what I'm going to do next is actually cut these muscles away from the humerus. So I'm going to have to get underneath them and then slice them or rip them, as the case may be, right off of the humerus. Now, the reason I'm doing so is because once we get underneath them, we'll see the biceps brachii, that muscle that's so important for flexing the forearm, the second most important muscle for that, and for supinating the forearm. So let me cut these off. I'm not going to try to maintain any of these in an intact fashion at all. I'm just going to cut these right off. There we go. Now, the muscle that you're going to see quite clearly next is this large one right here, and this is pretty sizable. And this is the biceps brachii again. Right next to it is the brachialis, and so the two of them are your forearm flexors, like so. Okay. If you want to spend some extra time, feel free to isolate that biceps brachii muscle a little bit better. And then, of course, up here is your deltoid. Okay, next muscle we're going to do is if we remove the pecs out of the way and we get underneath the arms, we're going to see probably my favorite muscle in terms of looking at it. It's a muscle called the serratus anterior. And you're going to have to go pretty deep under here. And here we go. And this is going to be a muscle that actually takes the scapula and attaches to the rib cage. And so here it is. Lift it up like so. And you can actually see it's serrated, meaning kind of like a knife, toothed knife, and you might be able to see the individual fingers of that muscle right there. And to make it, I don't know, prettier to look at, a little bit easier to understand, what I'll do is I'll remove some of this connective tissue out here. Then I'm going to isolate the individual heads of this muscle. Now, they might rip a little bit, but it sure is cool to look at once you're through it. So again, this is the serratus anterior, attaching the scapula, which is right here. This is scapula with all the rotator cuff muscles around it. And it's pulling it anteriorly. So this is a partial isolation of this muscle group. Now, what this muscle is most important for is, since it's attached to the anterior side, it's going to protract or pull the scapula forward. So if this cat was trying to punch me, it would be contracting that muscle, pulling the scapula and the whole arm forward like so.